Hi, everyone. I'm Kirsten Snyder, and I'm one of the cataract surgeons at Sacramento Eye Consultants. So to get started, Eye Consultants was established in 1988 by doctors Grootsmacher and Lewis. It's a doctor-owned practice, so not private equity owned. It's a leading ophthalmology practice with offices in Sacramento, Lincoln, and Folsom. And all of our surgeons are fellowship trained surgeons, and we all do cataract surgery. And then three of us, three are cornea trained, and three are also glaucoma trained. So doctors Lee, Sierra, and Wu are cornea fellowship trained. And doctors Brubaker, Liu, and myself also specialize in glaucoma and do minimally invasive glaucoma surgeries as well. So, why should you attend a cataract surgery webinar? Cataract surgery is a once in a lifetime opportunity, and you're going to have this vision for the rest of your life. The decisions you make will have implications for the rest of your life. Understanding the options is more important than just buying a car or TV or even planning a vacation. And there can sometimes be limited time during a consultation. So it's helpful to understand the pros and cons of the latest technology and be able to learn more about cataract surgery through this webinar. The objectives of tonight will be to understand the concept of a cataract, describe cataract surgery techniques and insurance coverage, think about lifestyle goals and your desires for glasses or not, learn about laser cataract surgery, understand the various lens options, as well as the pros and cons of the different lenses, and review the risks of surgery. So here's a quick video on cataract surgery. Bear with me while I get it up and running.
Cataract surgery is one of the most common medical procedures, and you have a choice in how it is performed, traditionally or via laser. In both traditional and laser cataract surgery, your surgeon removes the eye's cloudy lens and replaces it with a new intraocular lens, IOL for short. The main difference between the two methods is that traditionally, the surgeon makes the incisions and uses ultrasonic energy to break up the lens. By comparison, with laser cataract surgery, the surgeon first takes a 3D image of your eye to determine the precise location, depth, and length of the cataract. Using this information, the computer-controlled laser makes incisions and breaks up the lens into pieces. With both traditional and laser cataract surgery, the smaller pieces of the cataract are then removed from the eye using ultrasound and suction. Finally, the IOL is implanted into the capsular bag where the cataract used to be. Incisions in both procedures are usually so small that they do not require sutures. Both traditional and laser cataract surgery can help you achieve markedly improved vision. Depending on your eye health, vision needs, and IOL choice, one option might be better than the other. Talk to us today about which one is best for you.
All right. So intraocular lenses are similar to your glasses prescription. Insurance covers a standard single distance lens pictured on the right, which would be like a reading glass prescription or a prescription targeting distance vision. But there's also lenses that give you more of a range of vision, such as a multifocal lens, which would be similar to like a bifocal or progressive lens. So what happens during your cataract surgery? You'll get a full dilated eye exam. We'll also get measurements and lots of testing to determine the right lens prescription and the curvature of the cornea and any astigmatism of the eye. And then you'll get a chance to meet with your surgeon and discuss all the different options and which lens options would be recommended for your particular eye and desires. Some important considerations are your goals for your vision, particularly like what activities you like to do. If you like to do fine detail work, or if you're an avid golfer, do you mind wearing glasses for distance and driving? Or do you mind wearing glasses for near or computer work? Do you hate glasses? Do you want to decrease your dependence on glasses? Are you willing to pay out of pocket to decrease your need for glasses? Do you frequently drive at night? Are you bothered by glare or halos? Have you had prior LASIK or other eye surgeries? Do you have any other underlying eye conditions such as dry eye, glaucoma, macular degeneration? All these things can have an impact on your vision quality or what intraocular lenses might be recommended for you. So at Sacramento Eye Consultants, we have five different cataract packages. The first is the basic cataract package, which is covered by insurance. And with this lens, we do a standard single distance lens. So most people choose to be corrected for distance vision with this lens. So things like driving, street signs, and TV are clear, but you'll still need glasses for any astigmatism and for reading. The opposite can also be true, though. If you've been nearsighted all your life, sometimes people that are nearsighted prefer to stay a little bit nearsighted, meaning that everything in their immediate arm's length distance would be clear without glasses, but then they would prefer to wear glasses for driving or for distance. So that would be a standard monofocal lens. There's also a laser package, which is with a monofocal lens, but using the laser, which we learned about in the prior video. Um, some people have high astigmatism, and a toric lens would treat the astigmatism inside the eye as opposed to in your glasses prescription, which currently would treat your astigmatism. And so this would decrease your dependence on glasses for one distance. So if you chose distance prescription with the astigmatism lens, you would still need reading glasses with this. And then there's also a premium cataract package. And this would be for someone that wanted to decrease their dependence on glasses and have more of a range of vision for distance, intermediate, and near with a multifocal lens or with an extended depth of focus lens. And then lastly, there's a light adjustable lens. This is the latest technology and the only lens that allows us to customize the prescription of the lens after cataract surgery to really fine tune your vision and decrease your need for glasses after surgery. So the monofocal lens is the lens that's covered by insurance, so there's no additional cost. You'll likely still need glasses for distance and near, as it only has one focal point and it doesn't correct for any astigmatism. So you'll likely still need glasses for computer and for reading if you are corrected for the distance. The laser cataract package allows for more precision and control. It makes it so that it requires less ultrasound energy to break up the lens, and it also has slightly safer results with the surgery. And it can also correct low astigmatism in the cornea as well for your best vision. But you'll still need glasses for near and computer work with the standard lens for distance. The cost of the laser is not covered by any insurance, so it's an out-of-pocket cost as well. Here's a quick little video on astigmatism and what that means.
The cornea is the clear front window of the eye and should be perfectly round, like the shape of a doorknob. Astigmatism means that the cornea is slightly oval in shape, like the back of a spoon. If the cornea has significant astigmatism, then details such as print or street signs will appear blurred without glasses. Eyeglasses optically correct this blur by compensating for the oval shape of the cornea. The more astigmatism one has, the blurrier the vision is without eyeglasses. Astigmatism correction can also be incorporated into the artificial lens that is implanted at the time of cataract surgery. This is called a toric lens implant, and it must be positioned in a specific orientation in order to neutralize the astigmatism from the cornea. The toric lens implant does not allow you to both read and see far away without eyeglasses. It may not necessarily correct all of your astigmatism either. However, compared to a conventional lens implant that does not correct astigmatism, the toric lens implant should improve how well you see without glasses, and any eyeglasses that you do require should be less strong.
All right. Oops. So the toric lens corrects the astigmatism for your sharpest distance vision without glasses. It's not covered by any insurance, so it's an out-of-pocket cost. And you'll still need glasses for reading vision if you're targeting distance with the toric lens. And then we also talked briefly about a multifocal lens. So in this diagram, you can see that it's clear in the distance, reading the menu in the distance, as well as also being able to read the computer, which would be more of like an arm's length or intermediate distance. And then also being able to see the food on your plate, or in this case, the coffee mug. And then here's a quick video on multifocal lenses.
A special type of lens implant, called a multifocal, simultaneously provides both near and far focus and can greatly reduce your dependence on reading glasses after cataract surgery. This is because part of the lens focuses in the distance and part of the lens focuses up close. And indeed, the name multifocal means multiple focal points. The design is entirely different from bifocal eyeglasses, where you look through the top portion to see far away and the bottom area to see close up. The multifocal lens implant is engineered in a way to provide both a distance focus and a near focus at all times, and the brain naturally and automatically finds the correct focus. Conventional lens implants are called monofocal lenses because they cannot provide the ability to see both far away and close up without glasses. Both the conventional and multifocal lens implants are implanted through tiny incisions and are equally safe, and there are no differences in the surgery itself. Not everyone with a multifocal lens implant can read equally well without glasses, and there are several reasons for this individual variability. For example, the healthier the retina is and the less astigmatism one has, the better the reading ability will be. It is also easier to read without glasses if both eyes have a multifocal lens, although it can be placed in only one eye. While there is no guarantee that you will read as well without glasses as you desire, it should be much better with multifocal lenses than with conventional monofocal lens implants. The multifocal lens implant probably won't totally eliminate eyeglasses, because most people will still find it easier to read with glasses under certain conditions, such as prolonged reading, reading small print, or reading when the lighting is poor. However, multifocal lenses should provide the convenience of reading many things without having to put on glasses, such as your wristwatch, cell phone, price tags, menus, and magazines. This avoids the inconvenience of always having to wear reading glasses to view anything up close. Remember that when you do wear reading glasses, you should see equally well with a multifocal or a conventional lens implant. Although multifocal lens implants reduce your dependence on eyeglasses, there are some trade-offs besides the additional expense. The lens can create the appearance of halos or rings around lights at night. Fortunately, seeing halos is a distraction that doesn't obscure the focus, and most patients describe them as being minor. Halos won't be apparent during the daytime and will become much less noticeable over time as your brain gradually adapts to them. This is similar to the way in which your brain blocks out background traffic noise over time. A multifocal lens implant isn't right for everyone, and it won't work well if you have too much astigmatism or other problems involving the cornea, retina, or optic nerve. Remember that both multifocal and conventional monofocal artificial lenses will provide excellent vision with glasses following cataract surgery. The difference is in what you can see when you aren't wearing eyeglasses.
All right. So the multifocal lens, there's minimal to no reliance on glasses to see far away, mid-range, and near. It's most similar to natural vision, but the con is that you may still need reading glasses for super fine print. And some people experience issues with glare or halos around lights when driving at night. Although with the newer multifocal lenses, this is far less of an issue, and most people, this goes away after a couple of weeks. But you do need to have a healthy eye with no other eye problems to really get the full benefit of this lens. And then again, all of these specialty lenses, no insurance covers them. This is just an example of one of the multifocal lenses. And then here is an example showing you some rings around lights when driving at night and what some people describe with the multifocal lenses. So what if I'm not a good candidate for a multifocal IOL, but I don't want reading glasses? There's a couple of options. One would be to do what's called monovision, where you do one eye for distance and one eye targeted for near or intermediate vision. And then both eyes together in real life would give you more of a range of vision with less dependence on reading glasses. And you can do this also with what's called blended vision, where one eye is not necessarily as close of a target for near, but maybe one eye's distance and one eye's intermediate, so more like a computer distance. And there's also a light adjustable lens to really customize your vision. And then this goes over the different options as well. Depending on if you want to target distance vision, you'll still need glasses for computer and reading vision with a standard monofocal lens. If you are nearsighted and you're used to being able to read without any glasses and you want to stay nearsighted, you can target near vision, but then you'll still need glasses for driving and watching TV. And then there's also the options of blended vision, like monofocal, or I'm sorry, monovision, or there's the multifocal lenses to give you more of a range of vision as well. And then a little bit about the light adjustable lens. This is the latest technology that allows you to customize the prescription of the lens after cataract surgery using light treatments in the office to really fine-tune your vision. And here's a quick video on the light adjustable lens.
In the past, changing your intraocular lens, or IOL, after cataract surgery meant having another surgery. Light adjustable lenses are an IOL option that allows your doctor to adjust and improve your vision without requiring another surgery. Light adjustable lenses are similar to single focus IOLs, meaning that the lens will give you clear vision without glasses at distance or near, but not both. However, unlike basic single focus IOLs, light adjustable lenses contain photosensitive molecules that can be adjusted with certain wavelengths of UV light. Just like a tailor can alter your clothing to fit you best, your doctor can precisely adjust your IOL after surgery and fine-tune your vision. This precision is especially helpful to correct astigmatism, or if you've previously had LASIK. You can also try setting each of your two IOLs for different focal lengths to achieve clear near vision in one eye and intermediate or far vision in the other eye. However, if you try this and find the difference between eyes is too much, you can readjust your vision and change the IOLs back. Depending on how you set your light adjustable lenses, you still might need glasses for some activities, like reading fine print in dim lighting. In general, light adjustable lenses allow you to enjoy more freedom from glasses without experiencing halos around lights at night. After cataract surgery, you will return to your doctor for vision testing and 3 to 4 painless UV light adjustments spaced several days apart. During this time, you can try out and optimize your vision by adjusting the focal points for each eye at different lengths. After surgery, you are required to wear UV protective glasses all day long, both indoors and outdoors, so your new lenses don't accidentally change. After your final treatment, your lens prescription can no longer change, and you won't need to wear the UV protective glasses. Light adjustable lenses give you more precise control over your vision after cataract surgery. Depending on your priorities, this may be an excellent IOL strategy for you. So talk to us today.
All right, and then here's an example of doing the light treatments in office. So it's really quick and easy. You just have to stare at a bright light while we hold a lens to target the light treatment to the IOL. So, light adjustable lenses allow your surgeon to customize your vision after surgery so that you're twice as likely to achieve 20/20 vision at 6 months without glasses. And you have the unique ability to adjust the prescription as desired until the prescription's locked in. And you may need a total of 2 to 4 light treatments to reach your goals. And in the meantime, you'll wear UV protecting glasses indoors and outdoors. You get both a clear pair, so clear lenses for like indoors, and a tinted pair, more like sunglasses for outside. So this goes over the different cataract packages that we talked about, as well as the out-of-pocket costs. So the laser-assisted cataract surgery is $1,800. The astigmatism correcting lens, which all of these options come with the laser, that one is $2,600 out of pocket. The multifocal lenses is $3,600 for that lens technology, and the light adjustable lens is $5,000. And then that includes all the post-op care and all the light treatments and all of that. So the most important thing is to decide what's important to you and your vision, whether you'd like to decrease the dependence on glasses, whether you're okay wearing reading glasses. Are you willing to pay for some of the premium lens options that aren't covered by insurance to achieve your goals? Would you be bothered with rings or halos around lights at night? And then lastly, going over the risks of cataract surgery. Cataract surgery is a very safe surgery. It's the most common surgery done in ambulatory surgery centers across the United States. But like any surgery, there are risks, and those include things like bleeding, infection, the need for an additional surgery, retinal tears or detachments, glare and halos. Um, being not being able to choose the lens that you want because of other factors involved in your eye, or possibly needing a laser touch-up to sharpen your vision. But these risks are less than 1%, so very, very rare. So on the day of surgery, um, you cannot have anything to eat or drink after midnight the night before your surgery, except for sips of water with some of your meds. You'll get some sedation with an anesthesiologist, but you're not completely asleep, but you're nice and relaxed and comfortable. So you will need a driver because of the sedation. You'll go home with a clear shield on the eye, but no patch over the eye. And then we ask that you start your post-op drops that day when you arrive home. It's normal to have some mild discomfort, irritation, or like a foreign body sensation or burning. The biggest incision we make in the eye with cataract surgery is about 2 millimeters, so very, very tiny, but it can feel like a little scratch on the eye for the first couple of days while that heals. Vision may be blurry the first day or two. That's normal. And you may also see some halos around lights the first night, but that gets progressively better over the first couple days. Following the surgery, you can resume most normal daily activities. Vision may take a week to get fully clear after surgery. You'll need to use eye drops for about 3 to 4 weeks, including an antibiotic drop and a steroid eye drop to help with healing. And then usually you can get an updated eyeglass prescription with an optometrist 1 to 3 weeks later after the eye is fully healed. And then your second eye surgery is usually a couple weeks after the first eye. So, in summary, cataract surgery is a very safe surgery with low risk. It's a once in a lifetime opportunity to change your vision and dependency on glasses. We talked about the different IOL technologies and how an educated decision can help regarding your lifestyle choices and what you prefer. Consider investing in your vision. And then please think about your goals and share your concerns with your surgeon at your consultation so that you can make the best decision for your eyes and your lifestyle. And then at this time, I am happy to take any questions.
For
So,
those of you that were not in when we first started, you can type your questions in the Q&A section, and Dr. Steiner will try to get through all of them live. I will be also answering some, so if you're not hearing them right out loud, they are probably being answered within the chat. But
sure.
open it up. There is already one in there for you, Dr. Schneider, to get started.
So the first question is regarding prior LASIK, and how does that have an impact? So prior LASIK surgery changes the curvature of the cornea and the measurements for the lens, the intraocular lens that gets put in with cataract surgery. But nowadays we have a lot of advanced algorithms that take into account LASIK data to determine the best lens implant. But there is still a little bit higher chance of the lens not being the perfect target in an eye that has had prior refractive surgery, such as LASIK or PRK. And so, for people that really want to decrease their dependence on glasses that have had prior LASIK, the a really good option for that would be the light adjustable lens because it allows us to fine tune the prescription afterwards, especially given that the prescription may be a tiny bit off given the prior LASIK, changing the curvature of the cornea. Um, the next question, during surgery, will there be some assistance keeping the eye open? Yes. So we use a small eyelid spreader that holds open the eyelid so you don't have to worry about that. And then your other eye that's not having surgery, you can keep it open or blink, no concerns about that. So that's a very common concern, but you don't have to worry about that. If a patient has had RK via scalpel multiple times with 10 cuts in one eye, does this change the choice of surgical implant? Yeah, that's a good question. So, prior RK surgery is a type of refractive surgery that changes the curvature and stability of the cornea. And RK surgery in particular can result in fluctuations in vision and changes in the prescription of the eye, which can make it challenging to determine the best lens implant for that eye. That eye, you probably would not benefit from a multifocal lens because you would have more issues with glare and halos with the concentric rings of a multifocal lens. So, probably more of utilizing a monofocal lens or the light adjustable lens to really fine tune would be the best choices for an eye that's had RK, prior RK. After the first surgery, what happens to my glasses? Will the glasses lens for the operated eye be removed from my glasses frame? That's a good question. So, the prescription of your eye in the eye that has had surgery changes as you inferred. And so, during that time, a lot of people may ditch their old eyeglasses and just use over-the-counter reading glasses as needed. Particularly if you targeted distance vision, your distance vision in your operated eye would be much better after the cataract surgery. So maybe just using over-the-counter readers, or some people do prefer to take out the one lens of the operated eye, and just continue wearing their old glasses frame, during the time period in between the two eye surgeries. But that's also why we recommend doing the surgeries about a week or two apart. That way you don't have that mismatch or imbalance for too long. If I only have trouble seeing far distances, what are my options? So with cataract surgery, when we take out the natural lens of the eye, um, you you're still gonna lose so it sounds like you're nearsighted and can read without glasses, but are having trouble seeing distance. And so you still have to pick what distance you want to prioritize with a standard monofocal lens. So you could choose to stay to read without glasses, but then you would still need glasses for the distance after cataract surgery, with the monofocal lens. So you would still have all the same options like we talked about with a multifocal lens or wide adjustable lens. Or otherwise, with the standard lens, you're still going to have to give up either distance or near, depending on which one you prioritize. And then you would need glasses for the opposite. What type of retinal problems restrict the type of lens choices and why? So the multifocal lenses and the extended depth of focus lenses, because they diffract the light on the retina, it requires a healthy retina to get the full benefit of the lens. So if you have significant macular degeneration or diabetic retinopathy, which can sometimes cause macular edema or swelling, you're not going to get the full benefit of the multifocal lens. And so really only healthy retinas would benefit from some of the premium lenses. I had an IOL in my right eye years ago. I had monovision and lost my good near vision with the IOL. I desperately want my near vision back, which would have to be achieved by a multifocal. I had RK previously. So it sounds, I'm not, in this question, I'm not sure if you already had surgery on your left eye or in your right eye only. But the options would be to either do monovision with targeting near in the left eye to try to give you good near vision, or to do, you could do a multifocal lens in one eye only. But given that you had prior RK, I actually wouldn't recommend a multifocal lens. I don't think you would get the benefit of that lens because the RK can cause fluctuations in the prescription, due to the curvature of the cornea. So probably either you could do near vision in the left eye for uh, kind of a monovision, or you could do a touch up like PRK or something like that if the prescription had changed over time. Does previous recent laser for retinal tear have any impact on surgery? Um, so it is good that you had the retinal tear lasered prior to cataract surgery, because any intraocular eye surgery, including cataract surgery, can increase the risk of a retinal tear. And so you would want to have that treated before. And if the retinal tear was in the periphery and not impacting the central vision, you probably still would be a good candidate for many of the different lens options that we talked about today. But having a history of a retinal tear makes you a higher risk of a future retinal tear. So we would just want to keep a close eye on you in the post-op period, and make sure that there's no tears that have developed in the post-op period. How often, what percentage are toric IOLs done through traditional versus laser? So, all of our premium IOLs, including the toric lenses, which are for astigmatism correction, are done with the use of laser assisted cataract surgery. So, all of the packages have laser technology. And the nice thing about using the laser for the toric IOLs is that the laser can mark the axis of the astigmatism so that the IOL is lined up directly on the axis of your astigmatism for your best vision. If a patient has a history of RK and now has wet macular degeneration, does this change the course of treatment? So both the RK and the wet macular degeneration are gonna limit your options as far as the premium lenses go, because you wouldn't get the benefit um, of the multifocal lenses. You would still be a good candidate for a light adjustable lens if you really wanted to be able to fine tune the prescription. But otherwise, I wouldn't recommend a multifocal lens with any retina pathology or prior RK. And what about other finance options that should be without interest? Do we have such plans? That's a good question. Caitlin, do you know if we have like any of those finance options available?
Yes, the only finance options that we offer is through Care Credit. So you would have to have an active Care Credit card or account. And with that, you are able to do the payment with 6 months of no interest.
Okay, thank you. The next question, we were told that cataract surgery needs to be done before any retinal surgery. So that's a good question. So sometimes, if the cataract is very dense, it can limit the view into the back of the eye and the retina. And so in those cases, your retina surgeon may recommend that you get cataract surgery done prior to retina surgery. So that's very commonly done as well. And then how far out are we scheduling surgery right now? This depends on the doctor. I think we're scheduling out like 2 to 4 months in advance, depending on who you pick for your cataract surgeon. But those times are kind of standard, I think, across ophthalmologists. And if you get laser with a monofocal focusing on the ability to read without glasses, does the prescription change for distance? Yes. So, regardless of your focal point, the prescription will change after cataract surgery because you're getting a new lens implant and a new prescription inside the eye. And so you'll want to update your glasses afterwards. Any other questions, or were there any questions that I missed? Well, thank you guys for attending and for all your thoughtful questions. I really appreciate you taking the time to learn more.
Thank you so much for your time, Dr. Snyder, and for everybody for joining. Again, if a question comes up, feel free to reach out to the office. You can email me directly at marketing@SacI, or reach out to your surgical coordinator if you already have been in contact with them. Um, but it looks like we did
Oh,
have one
one
more
more question.
question.
Yeah. When going through the light treatments, will I still be able to see okay? Yes, you still will have good vision when going through the light treatments. And especially after you've had your first light treatment, sometimes it only takes one light treatment to get to your desired goal. And then we usually give you like a week or a couple days to try it out just to make sure it's truly what you want before we do the final. It's called a lock-in light treatment, and that settles the prescription and for stability so it doesn't keep changing. But yeah, you will still have good vision. And then if you have more questions that come up too, you can always ask at your appointment, and we're happy to go over this more in detail with you. You guys are